Hi, my name is Hana and I'm a medic and patient care advisor at MedBelle. My team and I are here to support you through every step of your journey, and we've made this short video to make sure you're fully informed about your upcoming treatment. Cosmetic surgery can be a significant, life-changing event, so not only do we help you find a fully qualified and experienced surgeon, but we also think it's important for you to understand exactly what's involved. The information we provide in this video is generalized to all patients, and because of this, it's important to recognize that your surgeon is the best person to give individual advice about surgical treatments, post-operative care, and risk of complications. Nonetheless, having a good understanding of your surgery means that during your consultation, you and your surgeon can focus on talking about what really matters to you. So let's get started. The aim of a tummy tuck is to create a more aesthetically pleasing abdominal contour. This is achieved by removing fat and excess skin that cannot be lost through exercise or diet alone. A tummy tuck would be suitable for patients who have excess loose skin from weight loss or excess skin and fat from pregnancy, or patients with weakened stomach muscles. As well as removing excess skin and fat, a tummy tuck may also help you get rid of unwanted scars and stretch marks to help achieve an overall improved cosmetic appearance. If you're looking for a cosmetic procedure to help you lose weight, a tummy tuck is not suitable for you. It's only recommended for patients with stubborn fat or excess skin that cannot be removed through regular exercise or dieting. It's therefore important to be aware that excessive weight loss after surgery may affect the aesthetic results of the procedure. We therefore recommend that you reach your optimal weight before you have surgery. Tummy tuck surgery, especially a full tummy tuck, may not be suitable for women who are planning on becoming pregnant. The surgery will involve tightening the abdominal muscles, therefore becoming pregnant after surgery will re-stretch those muscles. This will not only affect the aesthetic result of the surgery, but also put you at an increased risk of developing a hernia. For this reason, you should only consider a tummy tuck once you've completed your family. The medical term for a tummy tuck is an abdominoplasty. The surgery can take anywhere between 2 to 4 hours, depending on what type of technique is used. The three most commonly used techniques are a full abdominoplasty, modified or mini abdominoplasty, and an endoscopic abdominoplasty. Your surgeon will work with you to choose the technique that will achieve the best results for your body. When making this decision, they'll consider the following points: the amount of excess skin you have, the amount of fat you have, the tone of your underlying muscles, as well as your own desired outcome. A full tummy tuck targets both the upper and lower abdomen. The surgery involves removing excess skin and fat, as well as tightening the abdominal wall muscles. This technique is most suitable for patients with a greater amount of skin and fat that needs removal. The procedure requires 2 incisions to be made, one around the navel and another one that goes from hip to hip along the bikini line. In some cases, the surgeon may also choose to use liposuction to help remove excess fat. If you're a young patient with good skin elasticity and you mainly want to remove excess fat, your surgeon may recommend having liposuction as an alternative, less invasive procedure to a tummy tuck. A mini tummy tuck only targets the lower abdomen, so this technique is usually only used when a small amount of excess skin and fat needs to be removed. The abdominal muscles may or may not be tightened depending on necessity, and the procedure requires only 1 incision to be made across the bikini line. Although this does result in a smaller scar than a full tummy tuck, the final results may not be as effective. A mini tummy tuck may be a suitable option for women planning a future pregnancy. However, you should be aware that as a pregnancy will stretch your abdominal muscles, revision surgery may be required after you've given birth. Finally, we have the endoscopic tummy tuck. This procedure is the least invasive and is most suitable for patients with a protruding abdomen and only a small amount of excess skin. It's usually the best option if you mainly want abdominal muscle tightening. For this technique, several small incisions are made around the pubic line and the base of the navel. A small camera called an endoscope with small surgical instruments attached is used to perform the procedure. This means that an endoscopic tummy tuck causes very minimal scarring that can easily be concealed. It's important to be aware that cosmetic surgery is individual to each patient, meaning what you may need may differ to what another patient needs. Your surgeon is the best person to advise you on which type of tummy tuck procedure is best for you. And for this reason, it's important that you're honest and candid about what you'd like to achieve. How you prepare for recovery depends on how physically demanding your daily life and work routines are. Your surgeon will advise you specifically about the timeframes for recovery and when you can restart normal daily activities and exercise. But as an estimated generalized guide, we advise the following. If your job includes a lot of physical activity, for example nursing, waitressing, or caring for young children, then you should roughly plan to take about 3 to 4 weeks off work. If you have an office job or a job that does not require a lot of moving or lifting, we recommend taking at least 1 week off work. After which, be sensible and listen to your body. If it's telling you that you need more rest, then we recommend you stay at home and put your feet up. If you have young children, then you'll need to get your family to pitch in and help out. With regards to exercise, we recommend that the first 4 weeks you do not exercise at all. In particular, you should avoid strenuous activity and heavy lifting, but even basic aerobic activities might lead to increased swelling. After 4 weeks, you can restart aerobic sports that do not include heavy lifting or excessive movement, for example cycling. After 8 weeks have passed, you should be able to continue all sports and activities. There are a few other points that you should be aware of when preparing for recovery. Your surgeon may recommend that you do not drive for a period of between 5 days to 2 weeks after surgery. This is a safety precaution to ensure that all the anesthetic and analgesic effects have worn off before you begin driving again. You will be able to shower or have a full bath straight after surgery, as the drains will be removed before leaving the hospital. But please dry your stitch lines carefully with a towel or hairdryer. Finally, you will be required to wear a compression garment day and night for up to 6 weeks after treatment. This will help reduce swelling and promote wound healing. You may find it more comfortable to sleep propped up after surgery, so make sure you have plenty of extra pillows. You may also find it useful to rest and sleep on your back continuously in an inclined position for about 1 to 2 weeks post-operatively. After you have gone through your initial recovery phase, your body should have healed enough to allow you to see the full, permanent results 6 to 8 weeks after surgery. It can, however, take up to 6 to 9 months until everything feels completely settled. Our post-operative guide contains lots of great tips for recovery, and this will be sent to you prior to your surgery. But as this video and the brochures offer generalized advice given to all patients, we highly emphasize that you should follow the post-operative care that your surgeon recommends, as this will be specific to your recovery. It's important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications that you need to be aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and adverse reactions to the general anesthetic. There are also complications that can occur after surgery. Infections can be quite problematic and have to be taken seriously if they occur. If you are affected, it will become apparent in the first 2 or 3 weeks after surgery. A mild infection, such as a wound infection, will easily settle down with antibiotics. The package price you pay for your tummy tuck will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but can very occasionally happen up to 2 weeks later. If there is bleeding present, you would need to return to the operating room for further surgery. You're likely to spend an extra night in hospital and might be more bruised than expected, but everything should settle down over time, and it's unlikely to affect your final results. After surgery, it can be common to experience some alteration in skin sensation. You may initially feel some reduced sensation or numbness in certain parts of your stomach or rarely your upper thighs. However, this should only be temporary and will resolve itself within a few months after the procedure. Another complication that can occur is the development of a seroma. This is when there's a buildup of fluid underneath the skin, which most commonly occurs at the incision site. To reduce the risk of a seroma developing, drainage tubes are left in place after surgery to drain excess fluid buildup. During a tummy tuck procedure, the blood supply to the abdomen may be disrupted. This can result in damage to the skin and tissues around the stomach, which is termed tissue necrosis. If the disruption to the blood supply is large enough, it may result in tissue death or skin loss in that particular area. Depending on the amount of tissue affected, the damage may resolve itself within a few weeks, or you may need to have further surgery to remove the dead tissue. As tummy tuck surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and will become thin and barely visible over time. Although, unfortunately, the scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide we will send you. Your surgeon will be able to discuss the risk of developing all these complications with you in further detail during your consultation. It's sensible for you to be aware that there is always a risk that you are not satisfied with the aesthetic result of your surgery. We therefore advise patients to choose their surgeon carefully and make sure that he or she fully understands your expectations and desires. It's important to be candid with your surgeon about the results you want. We try our best to help with this by ensuring that your surgeon is a highly experienced BAPS or BAPRES member. When you go for a tummy tuck consultation, be prepared to discuss the following: why you want a tummy tuck, along with your expectations and desired outcome, your medical conditions, allergies, and previous medical treatments, and finally, your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. In order to make sure you are well prepared for surgery, our partner surgeons would like to promote the following advice. Smoking, alcohol, a high BMI, and any form of drug use, whether medicinal or recreational, can increase your risk of developing complications during and after surgery. In order to reduce this risk, our surgeons strongly advise patients to stop smoking and using all nicotine products at least 6 weeks before treatment. Smoking in particular is discouraged as it increases the risk of infection and delays the healing process. It's also worth noting that several homeopathic medications available over the counter and taken for general well-being can negatively affect the outcome of cosmetic surgery. Such medications include, but are not limited to, those containing ginger, ginkgo, cod liver oil, St. John's wort, aspirin, and several preparations of multivitamins. We therefore advise that all homeopathic medication is stopped 2 weeks before cosmetic surgery to reduce the risk of post-operative bleeding, excessive bruising, and hematoma. After your surgeon has covered your medical history, general health status, and medications, they will then examine and measure your abdomen, take photographs, discuss your options and recommend a course of treatment, and finally, they'll discuss the likely outcomes of a tummy tuck and any risks or complications. So now, on to what happens next. Essentially, your patient care advisor at MedBelle will be your main point of contact throughout the whole process, and they'll schedule a call with you shortly after your consultation. This is to discuss how the consultation went and to start planning your treatment journey for you. You'll also receive an email from us that details the specifics of what that journey entails. We will, of course, regularly check in with you during the recovery process, ensuring that you feel fully supported the entire time. If you have any questions regarding any of the information we've provided, please do not hesitate to give us a call so we can answer them for you. Thank you for listening to this MedBelle pre-consultation video. We wish you the best of luck with your consultation and cannot wait to find out how it went.